Across the nation, nearly 1 in 5 adults have experienced a mental illness. And over the course of 1 year, over 10 million people seriously consider taking their own life. Sadly, too many complete an attempt. Suicide is the 10th leading cause of death in our country, 4th in ages 35 to 54, and amongst 10 to 34-year-olds, it is the 2nd leading cause of death. These deaths are disproportionately higher in men. Suicide claims the life of at least 3 times more men than women in every age group above 15 years. But Nebraska is the good life. Surely we are immune to this kind of tragedy. Too many of us know that isn't true, and too few of us are talking about it. Suicide was the 9th leading cause of death for all ages of Nebraskans in 2017. And sadly, this has been an upward trend since 2010. After all, it seems like we have more access to each other than ever, and many of us have information literally at our fingertips. But treatment is not the same as information, and that desperately needed treatment is often not available. Nearly 1/4 of adults with a mental illness reported having an unmet need for treatment. There simply are not enough mental health professionals for our population. As a nation, there are seas of shortage, indicating many entire counties are in short supply of mental health professionals. Nebraska is no different. This gaping need for help affects most of Nebraska's population, but there is a noticeable disparity for those living in rural areas compared to urban and suburban environments. Simply by having limited access to medical care, even a primary care doctor. Having access to your trusted doctor is an advantage that many of us take for granted. Expand that to having access to any doctor, and you can see how disparities can look different than you may have thought. Let's visit with 3 men, all in their 20s and 30s, all working, all with access to family and friends, each one living day by day, but in 3 different locations. Let's discover what might be the same and different for these 3 men by asking them some questions.
So mental health, it's kind of like a broad word, big word. I think it's really important in life because it can affect your emotion, decisions, thinking, and I think it's very important.
It means having consistency in your life and not bouncing from being really depressed to really happy, but staying more consistent and doing the things you need to do to be successful in your life and have loving, caring family and friends. Just trying to be happy, I suppose.
It means how we handle stress and relate to others and make choices.
When they think that they are not good enough, they don't want to involve with the other people, like the lack of social skills, and so they just isolate themselves from others. So they lost and that they think they are not good and they don't want to involve and do anything with others, just want to stay alone, do things alone. So yeah.
I'd say lashing out at people, not recognizing what they're saying is incoherent or not true, using drugs or alcohol. Projects like saying something about another person, what it's really what they do.
Depression, anxiety, bipolar.
There's a lot of places that you can go get help, like the doctors, counselor, if you like school, or in the community leaders, maybe they can help you direct where you can go. I think the best way would be like a family doctors. I think reach out to your family doctor.
Certainly some people have more access to mental health. Some people have employers that offer help. Some do not. Health insurance with copays, speaking with friends and family, but sometimes that can be toxic. There's probably more help than people think there is, but you have to have the wherewithal to seek the help.
Probably counseling.
I actually don't know anyone that deal with mental health, but I know doctors. For counselor for high school, I think I might just reach out to my visit doctor first, and then that's the first step that I will do if I have the issues.
Yes, through work, it's very easy if you want the help. Through healthcare, people can see therapists with their copay.
The nearest ones are either in Grand Island or Kearney. We would have to drive 70 to 80 miles each way. Closest doctor is 20 to 30 miles away.
So it's for sure within 15 minutes by car.
I would say 15 minutes drive. I have never talked about mental health in the past in my life.
I don't really talk about mental health.
Never had any conversations about mental health.
As we talk with these men, we see that each of them had never talked about mental health previously and were a little uncomfortable talking about it. This social norm could likely be influencing the disproportionately high rates of suicide in men. But we also saw that they all have a different perspective of mental health awareness, different understanding of resources available, and very different physical access to help. Geographical challenges, as well as socioeconomic factors, could contribute to these disparities. Yet this isn't the end of the story. It can get better. As a society, we can recognize the need for health equity, understanding that everyone starts from a different place, and some are at an advantaged place. We can understand that mental health needs are not something that needs to be hidden, but that as a community, we can normalize conversation about needs and resources, as well as offer training to learn basic mental health first aid. We can ensure licensing of medical professionals to include regular mental health continuing education and create awareness of virtual or telecare options for individuals. We can create policy that supports education for mental health care and medical professionals through scholarships or loan forgiveness, recruiting them to high-need rural areas. We can ensure that there are adequate financial resources to support these measures. It's time to prioritize positive mental health and well-being, especially for men, and to recognize the unique challenges our rural Nebraskans face and discover ways to give them more equitable care. There is always hope for a better tomorrow.